Hi, my name is Rob Sweeney, and I've been asked for 610, a class at Aspen University, to discuss some specific issues regarding noncompliance with medication regimens. First of all, the question is, what is noncompliance? And just like it sounds, noncompliance is the act of not following the instructions given to you by the doctor who prescribed the medications. That can either involve over-medicating, like abusing the meds, taking too many, not taking them at all, taking them irregularly, taking fewer than was expected. In general, it's just not following instructions. There are several risks involved with noncompliance, and it depends on what kind of noncompliance we're talking about when you're talking about the specific kinds of risks. The one that's most commonly discussed is what happens if you simply just stop taking them. And I work at Crisis in Lebanon County in Pennsylvania, and often I have clients who come to me who've been off their medication for 2 or 3 weeks or several days. And the discussion has to start with noncompliance. Why did you stop taking the meds, and are you aware of what to expect when that happens? Most people, when they stop taking the medication, will notice some effects immediately, but they're not really aware of whether that's the drug doing it to them or there's something else involved. Whether it's particularly with its psychiatric medication, whether the side effect they're noticing is because they stop taking the med and it suddenly doesn't work, or if it's a side effect or there's something else involved. You have to keep in mind that psychiatric medication involves some sort of manipulation of the nerves and the brain. And so if you suddenly stop using that medication, what's going to happen to the brain and the nerves is that something that they had grown used to or accustomed to, something they were using to function, is suddenly no longer available. Those nerves and brain cells are then going to respond in a way that is uncomfortable. It creates all kinds of issues. For people who have depression and have been put on antidepressants such as SSRIs, that's a serotonin reuptake inhibitor. So if you have been taking a medication that inhibits the reuptake of cells and the serotonin in between those cells, what that means is that the cells are automatically then absorbing serotonin more quickly again. Serotonin is involved in happiness, in moods, in maintaining one's mood at the level it's at. So if suddenly what was keeping the serotonin available to those cells, what was keeping it in that synapse, is gone, well, then the serotonin's suddenly gone and the moods are going to go out of whack. It could potentially create some serious issues. More importantly, serotonin's involved in nearly every nerve cell in the body. And so things that are not necessarily associated with mood, but in just normal functioning would be affected. Things like indigestion, things like muscle movement, twitching, things like that. Just a general feeling of malaise, unsteadiness, illness can happen if you just stop taking your SSRI suddenly. There are other people who have allergic reactions to the SSRIs, and when they stop them suddenly, they get extraordinary responses. They start seeing things. They feel depressed to the point of suicidality. It's a really terrible experience. So stopping suddenly is not the way to do this. That's true of nearly every kind of prescription medication, but particularly for those involved with mental health. One of the things that people ask is, why do other people stop taking their medications as prescribed? Why are they non-compliant? I guess that's the best way to put it. And there are lots of reasons for this. One is, it's not doing what I expected. I hear that a lot. I was depressed. I was prescribed antidepressants. I took them for a month. I'm not happy. I just stopped. And now I feel worse than ever. You need to put me in the hospital. Antidepressants don't take away depression. Antidepressants take away the body's ability to manipulate serotonin, dopamine, and other chemicals in your nervous system in such a way that it's easier to manage your moods. It's a tool so that if you're depressed, you can do happier things, get away from what's depressing you more easily than you would if you didn't have the tool to use. Because depression could be debilitating. It can get to the point where it's so severe you can't think straight. So what the pill does is it makes it easier to think. It doesn't make it happy. Another reason that people are non-compliant with medications is that it's just inconvenient. heck, I'm okay. I'm a normal person. I took my medication, and I was schizophrenic before, and I saw things, and I took my meds. Now I don't see things anymore. I'm no longer schizophrenic. I'm going to stop my medication. And suddenly he's seeing things, hearing things, wants to kill the president, doesn't understand why we don't all see the same purple elephants he used to see. Schizophrenia is one of those conditions where the brain is permanently disabled, and without medication, it cannot process the input from the sensory organs correctly. So, just like those who are diabetic who need insulin every day, the schizophrenic who is helped with antipsychotic medication needs to remain on his antipsychotics in order to just maintain. Similar to diabetes along those lines, keep in mind, is that those antipsychotics don't necessarily work at the same dose and in the same way for a person's entire lifetime. They need to be adjusted occasionally. Sometimes they stop working. Sometimes they work well, but there's side effects you need to worry about. And that's another reason for noncompliance, but we'll talk about that in a second. But the issue with schizophrenics and with their medication, or those who have severe mental health issues and their medications, is they have to remember that it's a maintenance medication. You have to take care of yourself, and you need this medication to do so. It's no more weird, bizarre, or unnatural than the person who takes vitamins or the person who takes diabetic medications, and they need to treat it in the same way. Other reasons for noncompliance: it's inconvenient, it's expensive. I get that a lot. It's too expensive to buy my meds, so I didn't. Or I'm on pain medications, and I could actually sell my Percocet, and the difference between the cost of Percocet and heroin was such that I sold my Percocet, I bought heroin, I jacked up, and I could pay rent with the difference. If you're using pain medication that way, you kind of misunderstand what opiate pain medications do for you, and so that has to be discussed. Another issue is just sometimes compliance is difficult. There are people who have real difficulty understanding what pill to take at what time and in what manner. I know my brother, for example, has to take 35 pills in the course of a day. He has to have them very specially managed, or else he'll forget, and that can cause some real side effect issues. So for people like that, and issues like that, we have to talk about, well, who can help you manage your medication if you can't do it on your own? Can a relative come in and sort them out for you? Can the doctor look at cutting down on the medications? Can a visiting nurse come in and manage that with you? Talking about the doctor, that's one of the things that we talk about most often, is that if you're not compliant with your medication regimen, almost assuredly you've not spoken to your doctor about what the regimen was. He simply prescribed what he thought was best at the moment, gave you 15 minutes of time, you didn't say anything about it, and you walked out with the script. Many people have more than one doctor: psychiatrist, GI, PCP, the person they see in an emergency. And everybody writes different scripts, and everybody has a different idea of what's appropriate. And if you don't have a PCP who's managing all your scripts together, you can get some pretty conflicting medication regimens. The best thing to do is keep track of all your medications if you're on more than one. Keep a written list with you. Take them to the doctor every time you go to a doctor, and make sure they look at the list with you to determine if what they're going to prescribe is a good match for that regimen or if something else needs to be changed. If your specialist has something they want to recommend and they absolutely want to stick with that and it doesn't match something else, take everything you have to the PCP, your central family doctor who's responsible for managing your health, and talk to them about what's the best way to manage my regimen. Something else has to be managed because my specialist recommends this thing. It sounds like a lot of work in some cases, and for some people, their health is so awful that it seems like a full-time job. But for most of us, in most circumstances, on most issues that we talk about, it's simply a matter of 1 or 2 pills in the course of a day at the right time. A matter of keeping the idea of what it's for in mind, using it correctly, and sticking with your regimen to get the best benefit. And remember, it's not the pill that solves your problems. You do. And the pill's another tool that you're going to use to make that happen. Thank you.